We're very fortunate today to have with us a certified senior advisor who is also an independent advocate and a private consultant and founder of A+ Longevity. Lynn Shank, welcome to the Bladder Blog.
Thank you. Glad to be here.
Great. That's a long list of credentials. Can you kind of give us an idea of your area of expertise?
I help people when they are having health issues and maybe problems with insurance or claims. In the healthcare system, it can be very complex, and so I help them with the details related to whatever issue they're working with.
We're talking bladder cancer, and this disease tends to strike older people, but it can also hit younger folks. Knowing that it can be a long-term treatment, how does a person plan for protection?
Well, I think one thing is making sure that you have the proper insurance and that you understand how your policy works, what the limitations are. One of the most important features of a policy is the exclusions. Do you have a network of providers? If there is a cancer facility that you might want to go over any other facility, is there a specific facility that you might want to go to that does special kinds of work? Then making sure that your policy might allow you to go to any facility you want to. And especially if you may have a family history of cancer, then making sure those kinds of things are in your policy could be important. Also, carrying a cancer policy. If you have a family history of cancer, or even if you have risky behavior, if you've ever been a smoker, I understand that that is something that can enhance your chances of having bladder cancer. And so those kinds of things are important to have in the way of a plan. Also, in the years to come, I know right now they're working on some genetic testing that can tell you whether or not you have certain markers that could lead to certain types of cancer. And so in the future, I would say looking into that kind of testing might be important.
Interesting. So you think that's a possibility?
I think it is, yeah.
So is there a way to prevent needing to hassle with hospitals regarding billing?
It's tough to say, oh no, here's this plan, and with this plan you won't have to deal with any kind of hospital rigmarole. I think the whole issue of hospitalization and healthcare has just become very complex, and I'm not sure there's any one way to solve that. A+ Longevity does offer our members the opportunity to have the type of advocacy and management of healthcare claims or any issues that may come up when they're in the hospital that they just aren't going to feel like dealing with. And so having an advocate, I think, could be a very important thing to consider. Most of them get paid in one way or another, but might that be worth it to you if you're in that situation? Very possibly so.
We kind of addressed this in the book a little bit, and this is a complex issue. So how prevalent are billing treatment errors with hospitals?
Very prevalent. There's been a study done recently by one of the major news outlets, and they were talking about how often people have horrendous types of errors on their bills, and they really don't know what they're looking for when it comes to analyzing a bill. And many people just don't. They don't do it. They just simply don't sit down and analyze it.
That's too complex.
It is. But one thing that can happen is that insurance companies have multiple claimants at a particular hospital. So they can submit a payment to that hospital, and it may have payment for multiple claimants on that check, but it's only applied to maybe 3 out of 5, or maybe one person is left off. And so that person doesn't get credit for the payment. I mean, there's a variety of things that can go wrong.
So it seems to me like they need to talk to you.
Absolutely. Having an advocate can really help because they honestly don't know where to start.
Well, how do you see universal health care impacting the individual with bladder cancer issues from a long-term treatment perspective as well as Medicare?
Yeah, that is a 2-hour question. And I'm not sure it's one that anybody knows the answer to right now, because who knows where we're going to end up with, what we're going to end up with in our healthcare system. There are a couple things that are happening with Medicare right now, and since that's my deep area of expertise, I'm going to address those first. One of those that can have a serious impact on any long-term health situation is whether or not you are being admitted as an inpatient or simply under observation. The game that's being played right now, and part of that has to do with the whole focus on quality, and there is a readmission penalty, if you will, that hospitals will incur based on whether or not someone is readmitted to the hospital after a certain ailment in a certain period of time. And one of the games that they're playing right now is, well, okay, we will just keep them under observation and run tests. You get the IV, you get the green jello, you get the gown with the opening in the back, you think you're an inpatient, right? Well, not necessarily. I had a lady recently that was under observation for 11 days. The way this complicates things is if you are flat on your back for 11 days, you're going to need some kind of rehab, especially if you're an older patient on Medicare.
Sure.
And guess what? Medicare is not going to cover skilled nursing if you haven't been admitted for at least 3 midnights as an inpatient. So you have to be very proactive. That's the big change in healthcare, whether it's Medicare or just your under 65 healthcare. You have to be proactive. And a lot of times you can't. You're the one that's on drugs, blissed out because you're either in pain or whatever. And so you can't always know to ask the questions. So again, if you don't have a family advocate, you may need a case manager that is an independent case manager separate from the hospital that can help you manage your situation.
Do you see any possibility of individuals who are in Medicare being excluded from treatment?
Hospitals can't do that at this point. Doctors can choose not to participate in Medicare, or they can choose to participate in Medicare but not accept Medicare assignment, which means that they can bill you up to 15% above the Medicare allowed amount. And also, a lot of them require that you pay up front when you come for a visit. If they don't accept Medicare assignment, they want you to pay up front. They will file your claim, and then you can get reimbursed. But that leaves you out whatever it costs for that particular thing. And it also makes it more important for you to choose very carefully what Medicare supplement you have. Because there are some plans that even though you pay less premium, they don't cover what is called excess charge, and that's what a doctor can charge if he doesn't accept assignment.
Sounds like more complications.
It does get, it's hard to simplify that stuff. Really
So
is.
you're almost becoming a CPA. I mean, you're essential anymore with all this stuff,
Yeah.
which is probably a good thing for you.
Well, some people are just opting out of everything, which, yeah. And we don't know what we're going to end up with. It makes it difficult to help people plan because the whole game is changing. And there is no outline of what it's going to look like. It's all in flux. So, you do the best you can with the information you have today.
We would certainly hope not, but if you were diagnosed with bladder cancer, what would be your strategy?
Well, fortunately, I do carry a cancer plan. And our cancer plan, and these are some of the things to think about, we've been paying, I want to say, about $56 a month for both of us. It's not a huge plan, but it will pay on diagnosis. And that's really important because that helps you have the money up front to do what you need to do. Let's say we needed to travel to our area hospital that everybody looks at as the main cancer hospital is in Houston, and so 90 miles away. So that would give us some money to stay in a hotel if we needed to. We could do what we needed to do to manage all the details as far as the care goes. And then, it would also help with a deductible, because these days it's very expensive for people who do not have group insurance. You pretty much have to carry a high deductible or you're out $800 a month with a $10,000 out of pocket. All of that has to be satisfied before you get the full benefit of the insurance. And if you have something like bladder cancer, then that would certainly be the case. That cancer policy could pay that out of pocket. Okay, so that's another way to use that. And then your policy could pick up the difference. So I would first call my cancer policy folks and get them to tell me what I needed to do to file that claim. And then I'd probably have to hire an advocate, because Harry's going to be just worried about taking care of the business. So that's another issue. Are you a lot of us these days are entrepreneurs. We lost jobs, or we simply like being an entrepreneur, and we've always done that. Harry and I have been in business 20 years, and so you have to run a business when there's two of you working together. It makes it very difficult, especially when you have different areas of expertise. So making sure that you can keep that business going, that's another reason to carry a cancer policy, just to make sure you've got those funds.
So is there a particular designation for an agent that would help you kind of look at all this stuff that you could find in the phone book?
Well, I mean, that's kind of what A+ is about.
What if somebody's out in Nebraska? Well, I guess they could still call you.
They could still call me. And what I would do is CSA, Certified Senior Advisors, have a very broad network. It's an international program. Now, they don't always have the kind of expertise that you may need, but I have that network to draw from. There's also another network of care managers. There's a geriatric care manager or private care manager network that you can, there's National Association of Geriatric Care Managers, and you can tap into that network. I'm sure the American Cancer Society would have some possible resources for you. And so looking at national organizations first and then boiling them down to the local level is always a good place to start.
Great. Well, you're in the book, and you're a very important part of that book. How do you see the value of the book, and would you recommend it to your clients?
Well, I already have recommended it to my clients. My husband and I started reading the book as soon as I got it, and we were both in stitches. I mean, I think you had mentioned when you talked about writing this book that you wanted to do it from a humorous perspective, to help people engage better and keep it from being so dry that they just kind of glazed over. You definitely accomplished that. It's a fun read, and who would think? What are you reading? You're laughing so much. Oh, I'm reading a book on bladder cancer. Yeah. But it really is. It does lighten up something that could be a very dark, droll kind of read. Right. And it's very entertaining and very informative too. I like the fact that it's the patient's eye view. And so it's your experience, it's how you experience the process in a very humorous way. And I think it's a wonderful book. I think it's very helpful, and I think that it should be in the waiting room of every cancer clinic there is.
Well, thank you so much. I really appreciate that. That's very excellent praise for the book, and we're seeing a lot of people really enjoy it. So I appreciate those comments. Lastly, can you give us one real quick little pearl from your area of expertise about advocacy, insurance, and all that sort of stuff?
Well, I would say that healthcare and illness in and of itself is not for sissies. So don't be afraid to ask for help. Don't try to navigate it yourself, because obviously you're already overwhelmed just at the diagnosis and having to deal with this disease. So less stress is better.
That's terrific. Lynn, thank you very much for your time.